Good morning, everyone. Caring for the kingdom and for the national champions. Congratulations to the Kansas City Chiefs for their big win for another second time. Last night, Super Bowl 57. How fantastic is that? Good morning, everyone. Monday, February 13th. Hope everyone got some sleep last night. I'm Jessica Lovell, and welcome to the Morning Medical Update. The Dolph C. Simons Jr. Family Broadcast Studio is decked out in red this morning. As you can see, we are celebrating the Chiefs' second Super Bowl win in just 4 years. We also want to send our congratulations to the health system doctors, athletic trainers, and other healthcare professionals who were on the sidelines right there in Arizona last night and with the team all season long. And check out these photos. Our NICU nurses helped deck out these newborns, getting into the game day spirit. You can browse through some of those adorable photos on our Facebook page at KU Hospital. For decades now, we've known that smoking tobacco can lead to lung cancer, but more than 30 million Americans, well, they do it anyway. February is National Cancer Prevention Month, and the single biggest thing that we can do to lower cancer rates in certain cancers is to end smoking. Today, we are meeting a team that is driving down the number of smokers by engaging people right at the side of their hospital bed, right there at the bedside. We will hear their expert advice on quitting smoking and ask what else can be done to push smoking rates down even lower. Our guests are all part of the UKanQuit program, which starts right at the bedside, as we mentioned. Dr. Kimber Richter is the clinical director of UKanQuit and a professor of population health at the University of Kansas Medical Center. Good morning. How are you?
Good morning. I'm great.
Good. And also Dr. Ed Ellerbeck is the medical director of UKanQuit, also the chair of the Department of Population Health at KU Med Center. Good morning, Dr. Ellerbeck. How are you?
Oh, just great.
Good, good. Joining us virtually this morning are two tobacco counselors who have those bedside conversations with folks. They are Laura McCullough and Vidya Anatharaman. We welcome both of you ladies today. UKanQuit started in 2006. That year, they treated just under 700 patients. That program, though, has grown and is now treating more than 2,000 patients annually. In all, UKanQuit has helped more than 23,000 patients. And their team got into the Super Bowl spirit this past week, too. We have to just throw this in here. They turned the UKanQuit into UKanWin. So thank you guys for sharing that with us. Everybody get some sleep last night?
Yeah.
A little bit.
You said a little bit. Well, thank you for
later.
a little bit later than usual.
Yeah.
Okay, well, we're glad you're here anyway. Dr. Richter, so every single patient who gets admitted to our hospital gets asked, are you a smoker? We're always asked that, right?
Yeah.
Or if they are, do you want help getting off smoking and tobacco? What happens when they say the word yes? Yes, they smoke, and yes, they want help.
Yeah, well, then our people in UKanQuit go to the bedside, and they are not pushy or judgmental at all. They just check in with the person to see how they're feeling and if they're uncomfortable from tobacco withdrawal. And if they are, then they work with the medical team to increase their nicotine replacement therapy to make sure they're comfortable and can focus on what they're in the hospital for. And then they help them get together a treatment plan. Maybe it's not to quit. Maybe it's just to cut down or get more information about stopping. And then they set people up with medication, prescription for discharge, and also counseling, usually through the state tobacco quit line on discharge.
And I love how you mentioned not everyone's going to go cold turkey. Somebody might just ask to cut back or to just get information, because that's the start, right?
Yeah, it's a process.
It is a process.
Yeah.
Dr. Ellerbeck, we've mentioned by the bedside, coming to the bedside. Why does that matter? And is that something that's new?
Well, actually, it's relatively unique at the University of Kansas Hospital. I mean, lots of hospitals aren't doing this routinely, offering smoking cessation right at the bedside for hospitalized patients. We think it's a priority here at the University of Kansas, and it's important to catch people at the time when they might be ready to quit. You notice we didn't put an ad on in the middle of the Super Bowl.
You did not.
There could be a couple of reasons for that.
Right.
But partly, the audience there wasn't ready. Okay, when you're in the hospital, you may be there for a reason. Many of our patients are there for a smoking-related reason, whether it's heart disease or lung disease, and we can actually talk with them about smoking at a time when they're having an exacerbation and help them not only quit then, but help them prevent future readmissions.
That door is open, and you're ready to kind of walk.
They may be a little bit more receptive at that
Absolutely.
time.
So, Vidya, I have to ask you, are those bedside conversations difficult to have? Walk us through one. Talk us through one.
I'm happy to jump in here. We kind of prepped some of these a little bit. So, as far as the patients when they're in the hospital, it can be a really emotional time for patients. Sometimes they're in there for, as Dr. Ellerbeck said, for conditions that are directly related to their smoking. And so it can be difficult. They may feel like they're being blamed for their condition, but other times they're really motivated to quit because they want to do whatever they can do to begin to feel better. So we kind of have to navigate some of these different emotions that patients are experiencing sensitively, compassionately, of course, but we want them to get better. So we're there to provide that support. And, we know that the research shows that even if a patient states they're not necessarily interested in quitting now, if they are prescribed the medications to help them with quitting, they're going to be more likely to attempt to quit.
Well, and it's difficult when you're going through a stressful situation. Folks who smoke might tend to turn to smoking to help relieve a little bit of that, especially when you're going through a health condition, and certainly something major. Laura or Vidya, how does tobacco counseling fit into that larger medical team? Do you discuss these conversations and share what you learn with the doctors and the nurses?
A tobacco counselor, they play a critical role in helping people quit smoking as part of a larger medical team by providing comprehensive care, which might include educating the patient about dangers of smoking, assisting them in developing a quit plan, offering support throughout the quitting process, like how Dr. Ellerbeck and Dr. Richter and Laura mentioned, by not being pushy. We listen to their stories, and it's very important as part of that process. So trying not to tell them to quit, and no matter where they are in their quitting process, ask them if they need any medications while they are inpatient, or if they are interested to quit, provide any kind of recommendations for medications on discharge. And coming to talking with doctors and nurses, we do use an internal messaging system called the Volt, where we, after we talk with the patients, we make recommendations for medications, inpatient medications, as well as medications on discharge.
Laura, once you learn someone wants to quit, let's talk about a quit plan for these folks.
I can answer that. Research has shown that individuals who are counseled to quit smoking have a better chance of quitting compared to those who might not have received any advice. In that process, creating a quit plan is a key step. Why it's important is it keeps them focused and motivated, and also it helps them identify challenges that they may face and ways to overcome it. Now, what
Laura
might go into a quit plan? The first step would be to pick a quit date. Usually, it's about 2 weeks that patients prefer because it'll give them time to prepare, avoid any kind of stressful days, or attach it to any. We ask them not to attach it to any birthdays, anniversaries, any kind of key milestone days. The next would be to, letting your loved ones know that you are quitting, and remove any reminders that might cause cravings. Also, identify your reasons to quit, and maybe some patients would like to have it on a Post-it note. And anytime you do have cravings, review them. And another step would be to identifying your smoking triggers. Certain activities, habits can trigger smoking, and by identifying those triggers, you can develop ways to deal with them. Finally, coming down to coping strategies, nicotine is a chemical that makes you addicted to smoking. So distracting yourself by taking deep breaths, going for a walk, and maybe listening to music, calling a friend, etc., things like that. And we all know we did mention we provide resources, so keeping those resources handy, whether putting on a patch or using a gum or a lozenge whenever they need it. And it's important to remember to reward yourself because quitting smoking is hard, and you need to be proud of yourself every step of that quitting process.
Yep. Day by day, one cigarette at a time, or whatever type of tobacco products you use. So quit date, write it down, figure out what those triggers are, and then start strategizing on those coping skills and what you're going to use to help alleviate those moments. Dr. Richter, what resources exist people once they leave the hospital? Where do they go?
Yeah, well, let me tell you, most people don't know, but it's never been easier to quit using tobacco, whether it's smokeless tobacco or cigarettes. Most health insurance plans cover FDA-approved quit smoking medications, including 5 different kinds of nicotine replacement therapies, some of which people have never even heard about, like the inhaler or the nasal spray, and also non-nicotine medications like the varenicline, which is also known as Chantix, or bupropion, which is a very widely used medication. And so your insurance plan, if you have it, will cover it. Also, there are many different ways to get support for quitting. If you have any access to any kind of personal therapist, you can work with that person on it. But also there is the Tobacco Quit line. There are wonderful text messaging programs. There's websites. And the University of Kansas Cancer Center also has its own quit smoking online group that we refer people to in the hospital, which is a wonderful group process for quitting. And then Kansas Medicaid, people are golden if they are beneficiaries of Medicaid, because they get 4 rounds of quit smoking medications, including combination nicotine replacement therapy. Quit lines also, both in Missouri and Kansas, provide free nicotine replacement therapy for 4 weeks for anybody, and in Missouri for 8 weeks if you have any kind of mental illness. So there's just tons of different ways to get access to medications and counseling.
I want to put some information up. Thank you for laying that out. Information on your screen right there, the number, the quit line, 1-800-QUIT-NOW. You could also text QUIT to 47848. So please jot those numbers down for when you are ready to give that up. If somebody signs up for the text, what kind of service are they getting?
Yeah, it's pretty cool. So you'll text 47848 to quit to that number, and then you'll get a few questions. I can't remember, just 1 or 2, and then it asks you for a quit date. Now, if you're not quite ready to quit, you could either just put one in, or if you're ready to quit, put your quit date in. It's important to remember that the algorithm is looking for a quit date within the next 2 weeks. So you might just want to plan a quit date for the next 2 weeks if you want to use that text messaging. Then it'll send you some attaboy messages like information about quitting, just encouragement. And then also you can text words like crave or mood to it, and get some tailored messages on how to overcome cravings, like in the second if you need it.
Kind of like a little app.
It's really nice.
Really to keep you going.
Yeah,
I mean, we all need that.
Like a little good monkey on your other shoulder. Right?
Absolutely.
Yeah.
Also, you mentioned mental illness. What's the connection between smoking and mental illness?
Yeah, people with mental health issues on average have much, much higher rates of tobacco use. And also, more folks use tobacco, but they also might use more tobacco products. So in general, it's harder for folks to quit, and so people who use higher levels of tobacco might need actually more medication, more nicotine replacement, more frequent short-acting nicotine replacement. So also people are afraid, I think, with substance use disorders or with other forms of mental illness, they're afraid that if they stop their tobacco use, then it might knock them off of their recovery. Mm-hmm. But we found that actually, and also much literature suggests that people actually do better with their mental health issue or even their substance use disorder, whether it's alcohol or other drugs, if they even just try to quit smoking, because they get off that roller coaster of craving, withdrawal, use, whatever, and their mood stabilizes and they're able to focus more on their health concerns.
That is really good to know.
Yeah.
And it's not something you would think about, because you would think
No.
that they would kind of go hand in hand and kind of one would support the other. So
Yeah.
good to know. Okay, Dr. Ellerbeck, I'm bringing you in here because I actually have a personal question, but I want to ask you your message to someone who says that they understand the risks of smoking. And I'm going to call out my beautiful, wonderful, amazing sister who has been smoking since I can remember. I mean, she started smoking back in the 80s and has said she quit smoking while she was pregnant. Boom, then hop right back on again. And as many, I've said, if you quit smoking, you're not going to want it anymore. And she looked at me and she goes, I don't want to not want it anymore. And I said, that's the addiction speaking. So I said, but if you, the patch and the gum and all these things that were not available back then, I said, but she did. She goes, no, she's like made up her mind. She knows. But she's still doing it anyway. What do you say to people like that?
So first off, most people really do understand, at least in general, the risks of smoking. And
They know it's bad.
Yeah, but they're ambivalent about quitting. I mean, because frankly, the cigarette just makes you feel so good. The addiction to the nicotine just gives you a reward every time you're taking a puff. So what we frequently will do is we might shift the conversation a little bit. Sometimes it's not just thinking about their personal risk, it's actually thinking about other small steps. So your sister quit while she was pregnant. Congratulations.
Yes.
That was a great step. But she also has children in the home. And you know, she's probably very ambivalent about smoking around the children.
She does. She's out. She does it out in the garage.
So
she's actually set up a living room, like in her garage, so she can smoke out there, and a TV.
And so that is actually very helpful to actually set up your home as a. So that's actually another a great step. The other thing is that people realize how hard it is to quit, and they don't necessarily know that they can be successful. And so being able to talk with them about. We actually use two strategies. One is we work on motivational interviewing. So we might actually address some of that ambivalence they have and get them to articulate some of the reasons why they really would like to quit, because she really doesn't want the kids to know she's smoking. Okay. The other thing that we actually do is to try to promote what we would call self-efficacy, the idea that you actually could be successful, because thinking that you might fail is a real strong inhibitor to making an attempt. So talking with some of the resources that Dr. Richter actually just talked about, I think is very important. Letting them know that there's resources with the counseling out there available, and that some of these medications really can drive away some of those cravings.
So it's more than just an addiction. It's a mental thing, like you said, afraid to fail.
Yes.
Right.
Fear of failure.
Fear of failure is a big,
Yeah.
I think, is a big issue. In
It's almost like they just buy into it.
Yeah.
Nope, I can't do it. I don't want to do it because they don't want to fail. What can you add to that, Dr. Richter?
Well, number one, I wish Dr. Tanisha Sherman was in the room with us, because she's an expert on pregnancy and quitting tobacco use.
Oh, we'll bring her in then one time.
You should.
We
She's
will.
terrific. But number two, anybody who's ever been pregnant, they know the connection between the brain and the body, because that breathing really does help when you're about to give birth, because your body responds to your mental state. And so another thing that you can do when your mind is telling you should quit, but your heart is telling you you don't want to, is to use medications, because medications can help take away that craving, and then you may be surprised that you feel free to want to quit. And we found that people who take medications in advance of quitting are actually much more likely to stop than people who just start taking medications when they're ready to quit. Does that make sense? So you can use medications to reduce that desire and help you get down the road toward quitting.
All right, I want to ask you about Biden administration declaring February officially in 2022 National Cancer Prevention Month. When we hear these declarations or these big initiatives, certainly coming from a national level all the way at the top, what does that really translate when it comes to possible cancer numbers? Because we're talking about smoking, which can prevent cancer. What does it really mean?
Well, a lot of the so often we talk about cancer treatment and trying to find a cure. But so much of cancer could actually be prevented. We've clearly talked about the most important risk factor, which is smoking. Obesity is another risk factor. But there's also some really interesting technologies coming out that can personalize cancer prevention, identifying individuals at risk, getting them in for screening earlier can also help to prevent. And so I think this could really shine a spotlight not only on the big behavioral strategies, but also helping us identify those at risk and getting them treatment.
Yeah, Yeah, because we don't just want to hear we've declared some month is that, because it's year-round, 365, all the time. So what does it mean, Dr. Richter?
Yeah, well, about a third of cancers are caused by tobacco use. So if we could eliminate tobacco use, then we'd probably cut out about a third of cancers. And I'll bet if viewers think hard, they can think of family members who've either had tobacco-related cancer or tobacco-related heart disease. So if you think that if you could have eliminated tobacco, you would have extended the lives of all those loved ones and friends. It's huge, tobacco is.
And I just forgot, probably really important is we actually now have a vaccine out there to prevent cancer. So if you've got teenage kids or those in the 9, 10, 11-year-old age range, get them that HPV vaccine. That actually prevents cervical cancer and head and neck cancers as well.
Yeah, thank you for saying that. If you have questions for our smoking cessation experts, please send them in right now to YouTube, Facebook, and the Medical News Network. We're going to get to those in a moment. There are some links there for your right there on your screen, but let's get a quick check on our COVID count with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. How you doing? Did you get some sleep last night?
Yeah, it was good. It was fun watching the end of the game, of course, and then watching all the local celebrations at the areas around the places around the city.
Nice to see it again.
Yeah, it was good.
All right, what you got? How are the numbers looking?
Numbers are holding steady. 27 active, so 49 total cases, but 27 active cases, 5 in the ICU, still 2 on the ventilator. So we're still hanging out in that mid-20s as far as active cases go.
All right, Doc Hawk, we expected this to happen, but now it is official. The CDC has added COVID-19 vaccines to the routine vaccination schedule. We should point out that these are technically recommendations. Schools and businesses still have the final say on whether to require that vaccine. But does this mean that we should think of COVID vaccines as a yearly thing, just like the flu shots?
You know, I think right now, and especially when you take into account people with certain health conditions who may be at higher risk, I think it's vitally important. But also for kids, I mean, we've known for a while that children, pediatrics, do suffer less than adults, but they can still have severe disease. They can still have long COVID. We know those vaccines do help reduce the risk of that even for kids as well. So I think it's a good measure and a good step to go by. And again, that is for the information, the data that we have right now. And I think moving forward, those things, those recommendations will continue to be evaluated as well.
All right, Doc Hawk, thank you so much. All right, do we have any reporter questions on the line today? All right, let's get to our community questions. And Jerry wants to know, does UKanQuit cover vaping cessation?
We absolutely do. And really, to help people quit vaping, it's really the same kinds of things that you would for quitting smoked cigarettes. So medication, some kind of support. I will fess up that all 4 of my children have smoked cigarettes, and 2 of them quit and then went on to start vaping. I could have killed them. And I think they found that quitting vaping was as hard, if not harder, than quitting smoking, because you can get very, very high levels of nicotine in your body. So don't, if you want to quit vaping, then you can use the same kind of supports as we mentioned for quitting smoking. And please don't forget the medications, because they are super helpful in stopping vaping.
Vaping is not the gateway to quitting smoking, correct?
It can be. It can be helpful in quitting, but the problem...
But then you now have a new problem.
Yes, and many people who use vapes to quit smoking, they actually continue smoking. But vapes can be helpful in stopping smoking cigarettes, but then you have the vaping, and we don't know what the long-term effects of vaping are. So it's really best, and what UKanQuit does is really encourage people to take advantage of all the FDA-approved medications that are out there and the new access that we have.
Tim has a question, Laura or Vidya. What's the hardest part of quitting for these patients or a lifelong smoker? You know, what are the withdrawal effects? What are you hearing from patients that they say is the toughest hurdle to get over?
Yeah, I can take that. So, you know, of course, as far as a withdrawal goes, that can last mostly for the first week, maybe the second week as well. The actual physical effects, which, you know, may be that irritability, that might be your mood, some depression, anxiety increase, restlessness, increased hunger, all of that. And in terms of those symptoms, what I hear from patients primarily is the effects on the mood and the irritability. And I've heard from patients even that, you know, while they're just trying to quit that first couple of weeks, their loved ones will buy them a pack of cigarettes because they want them to go back to normal. And they also, don't like to see them suffering too. And so that's hard. I also hear from patients it's really hard when they live with somebody who smokes, because then they're constantly reminded, they smell it, they see it. That makes it a lot harder for patients. Now, those other those cravings that aren't just the physical cravings, those can last a lot longer, months, even longer for some people. And so that really gets down to the habit, the ritual of it. For some people, that was their only break. For some people, it's social. They smoke with a loved one, for example. So it's really about disrupting those habits, those associations that people already have in place, changing their routines. That's really difficult to do, especially when you're not given necessarily that time to change those routines. So finding what works for stress management, for example, a lot of patients I talk with, they smoke for stress relief. It's a quick thing you can do. It reaches your brain almost immediately. And so without that, they're scrambling for something else to fill that place. And so they need that support.
Joellen wants to know, is the quit plan available for someone who isn't in the hospital? The quit plans that we talked about earlier, is there a place that they can go to find out more information about that? We talked about that.
I can take
Vidya?
So yes, once they contact the 1-800-QUIT now, the quit coaches definitely work with the patients, work with those individuals who are interested to quit, and they can definitely talk with them and create a quit plan, even if they are not inpatient.
All right, couple more questions. How do I convince my 17-year-old son to quit smoking? You two tackle that. Let's get after it.
I'm the expert. Well, I was kind of a tiger mom about it, and so they would just wake up in the morning, and I'd already left for work and put a patch on them. And
just slapped that patch right on.
Yeah, and they would wake up and they're like, I don't really feel like smoking today. I wonder why that is. And then they'd have to start.
I love this plan already.
So, yeah, I mean, the thing is I did, as a tobacco treatment expert, understand that people who use medications in advance of quitting can actually increase their odds of quitting. So I would put a patch on them, and then they could actually see that, they didn't have to feel craving or withdrawal. But then I talked to them a lot about it and how much it harmed them. And then also their father smoked. And so he stopped a long time ago, but, he talked about how hard it was, especially the longer that he smoked. And they both, I guess, just talking them, not shaming them or judging them or yelling at them, but just constantly encouraging them, telling them I love them, making the medications incredibly available to them. So I just bought it, and it can be expensive, but I did that. But you can also get access to them through the Quit line and stuff like that. Just making it easier to not smoke than it is to smoke.
Is this why you got into doing what you did?
Absolutely not.
Okay, that's what I was wondering.
No, but both my parents
So you were already doing this, and the kids.
Yeah.
Okay, so were the kids hiding it from you?
No, we have a pretty good relationship. So, and I could also smell it. So one difficulty in parents who smoke, who don't want their children to smoke, is that they often can't smell the smoke on their kids. So they feel terrible when their kids pick up smoking when they really didn't want them to, but they haven't been able to stop. So that's an advantage that parents that don't smoke have, is that when their kids are smoking, very often they can smell. So I could smell it. So they didn't try to hide it. Yeah, so we talked very openly about it. My one son started when he did an international exchange in Ecuador, and the smoking prevalence is much higher there, so he picked it up.
Culturally, for sure. I want to talk about, before we go, I want to ask both of you, because I want to know how it's affecting the patients that you see in the program, but let's talk about smoking laws and as far as if you think they could be, where we've come with those, and if you think they could be stronger and better. I'll start with you, Dr. Richter, and then Dr. Ellerbeck, jump in.
Okay, sounds great. Yeah, in fact, Ed is more of an expert on this than I am. Both he and I have been really active in the clean indoor air ordinances that we've gotten in the cities and then in the state. And now people are really trying to work toward, well, Tobacco 21 was a really big one that happened a couple of years ago. But now really looking at things that are attractive to youth, like flavored tobacco products, and trying to eliminate those so that we don't have these kind of training wheel type products for kids to start.
Dr. Ellerbeck, tell us your passion and if it's being put into motion the way you'd hoped.
So two passions. One, both linked to what Dr. Richter was just saying. First, Missouri still doesn't have a statewide clean indoor air law. There are bars in Missouri where you can still find people smoking. And if you're at a bar and somebody's smoking next to you, it's a lot harder to quit, and you're just more likely to start up smoking again. I do recommend my patients who actually are going into bars is that they pop some nicotine gum before going in to crave some of the urging that they may get in advance. The second thing is Tobacco 21 is a real game changer. It actually reduces the number of 18-year-olds who actually can bring tobacco products into the school. What we really need is better enforcement, though. We need tighter licensing of places where people can buy tobacco and vaping products, and then we just need more tighter enforcement of those regulations.
So we've come some way.
Some way.
Still
We've got the
ways.
law in place, we just haven't actually enforced it to the extent that it needs to be enforced.
And where does your passion for this come from?
Basically, just the love of kids. My wife's a pediatrician. She cares about kids, and I've raised teenagers of my own. And really seeing the illness that it affects individuals when they're in their 50s and 60s.
Yeah.
And I just don't want them to suffer those same things.
Yeah, you see it firsthand. Just lastly, is secondhand smoke is what we always say that being bad. I grew up with a smoking mother, and it was in the house and it was in the car. What are those risks?
There are about 50,000 people who die each year from exposure to secondhand smoke. The biggest issue is cardiac disease. So if you actually have any cardiac risk factors and you're hanging around other people that smoke, that actually affects you and increases your risk of having a heart attack. Lung cancer is also a risk. Secondhand smoke affects our babies, our children, increasing risk of SIDS, lung infections, low birth weight, etc.
Getting people off smoking and keeping them from even starting in the first place. That is the key. Let's get to final thoughts. And Vidya, I'll start with you. Final thoughts for our audience today.
We all understand that tobacco is one of the most addictive drugs, and quitting smoking is hard, might take multiple attempts before success. But the key thing to remember is don't wait. Please do ask for help.
Thank you so much for being with us. Laura, final thoughts.
Yeah, just highlighting that despite a patient's interest in quitting, that providers can really support a patient simply by prescribing the patient medication while they're in the hospital, the clinic, wherever they may be. So just highlighting the importance of the provider support in helping a patient to quit.
Laura, thank you so much for being with us today. Hopefully we have inspired even just one person to take that first step. Dr. Richter, final thoughts?
Yeah, I'm going to tackle the partner or loved one smoking dyad. If you use tobacco and a loved one also uses tobacco, you could say, wow, it's going to be super hard for me to quit. I don't know if I can do this without them committing to. But we also have research that shows that people who have friends who quit smoking, they're more likely to quit smoking themselves. So you could turn that around and say, I'm going to help myself, and I'm going to help my loved one, my kid, whatever, by quitting smoking. And people do it all the time. My dad was able to quit. My mom never was able to quit. They both died from tobacco-related illnesses, but my dad, he lived a whole lot longer because he was able to quit. So if you are able to quit, then all the people around you who use tobacco, you're going to be helping them get that much closer to quitting.
Thank you for all you do. Appreciate it. Thank you. Dr. Ellerbeck, final thoughts.
Well, as Vijaya and Laura indicated, lots of people have tried quitting smoking multiple attempts, and so they're frustrated. They worried that they may not be successful. As physicians, we actually have lots of different alternatives that we can use. Not only do we have the 5 FDA-approved medications, the counseling and the text messaging, but different ways to combine those treatments to actually tailor treatment to the needs of an individual. So talk with your doctor, talk with your counselor. I think we have some opportunities to help you.
Thank you so much. I appreciate this panel. Great discussion. Dr. Hawkinson, final thoughts today.
Yeah, I mean, such a great program and has been going on for quite some time, just as we heard our guest talk about. So important, and doing that for yourself also, as we've heard, helps other people around you as well. So really try to get that help and quit smoking.
Doc Hawk, thanks so much, and thanks to all of you for being with us today and all your great comments. I know so many of you out there trying to quit smoking. Remember, that help is still available. If you're not ready to quit, that help will still be there for you. Call those numbers, get involved with that text line, and reach out. It will be there. We're ready for you. Everyone, have a great day. Coming up tomorrow on the Morning Medical Update, new advice for childhood obesity. Doctors say some kids need weight control drugs. I'm Jessica Lovell on the next Morning Medical Update. We break down the first ever guidelines for treating, not just preventing, childhood obesity. The focus so far has been diet and exercise. But when should parents consider medication? Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.